I'm often asked, what makes concierge medicine different than regular medicine? What sets that apart? Why do I need something like that? And in addition to things that you've seen in the past, both on our website, read about, things you may understand or know about concierge medicine, we have time. We're able to sit down and actually problem solve with patients in a more meaningful way, because we don't have the constraints of short appointments. We have opportunity and space to have a 30-minute appointment or an hour appointment. What do we need to really work through what's going on with the patient? Another thing that we do in concierge medicine, at least in my practice, is we do advanced cardiovascular testing. It's interesting, just this week it came out that they've lowered the blood pressure normal level from 140 to 130, and patients have already asked me what my opinion about that is. And the reality is we've seen that get lower, the goals for your blood pressure to get lower, the goals for cholesterol get lower over the last decade. And that's happening primarily because we're failing at preventing heart attacks and strokes. And so the solution primarily in the medical field is, well, let's just drop the number and see if that improves things. And the reality is we miss it if all we do is look at a number. So if we're just looking at just your blood pressure when you walk into the office at any given time, we're missing what real risk is. I'm a big believer in the Bell-Dineen method of evaluating a patient for true heart attack and stroke risk. And that method utilizes labs that are different than the standard labs you're going to get when you go see your doctor. We look at inflammatory markers that are very, very specific for cardiovascular disease. We look at a more elegant breakdown of your cholesterol. We're interested in whether or not you actually have plaque in your artery. So we do ultrasound imaging of the carotid arteries to determine, do you have plaque in the artery? And if so, what do we need to do about it? We tend to, in medicine now, we're very reactive and not very proactive. And so my goal at Johnson County Concierge Medicine is to not be like everybody else, to provide a service that actually prevents heart attacks, that actually prevents strokes, so that we can partner together and determine what's in your best interest. How should you eat? What should your fitness look like? Are there supplements that you need to be taking? Are there medicines that you need to be taking to decrease your risk? And so those are things that are important, rather than taking the approach that we're just going to watch a traditional cholesterol panel until it's too high. Let's actually start before that. What's underneath that? And we determine what is the best approach to help that individual be healthy, to live well, and to not have a heart attack, to not have a stroke. We're after health, we're after wellness, because that is really living. If I'm just band-aiding a problem that occurs, then we miss it. That's not really healthcare, that's called disease management. But I encourage you to take the opportunity to call the office, make an appointment, talk to me about what that looks like. I believe that there's harmony in traditional medicine and functional medicine. We can find a way for both to work together and not to be so far in one camp or the other that we miss an opportunity for improved health. That's my goal. I want to sit down with you, I want to spend time with you, I want to talk to you about what your risk is, so that we can prevent your heart attack, prevent a stroke.